Welcome back to this Open Season Exchange segment with Shane Stevens, Associate Director of Healthcare and Insurance at OPM. Shane, thanks again for being here.
It's great to be here, Drew. Thank you.
So before the break, we were talking about a lot of the really big initiatives that OPM is looking at with changing FEHB and PSHB. But I want to ask about something that happened a little bit earlier this year. Over the summer, there was an Inspector General report from OPM that said that there were issues with staffing shortages and some budget issues that were putting essentially the Postal Service's enrollment platform at risk of a failure, and especially that could affect things heading into open season. So I just wanted to get a pulse check from you. Where is OPM now with addressing some of the issues that the IG brought up?
Wonderful. Yeah, so when I first got here in June, that was a big topic of conversation. And we have a great IG team. They do a wonderful job of keeping us compliant and keeping us on our toes. A lot of intelligent people there. And so there was a lot of good information in that report that was actionable. And since then, we've taken a look at our staffing. We do believe our staff can work effectively through everything. We've resolved that. And then for present, we're just working to build a best-in-class, world-class open enrollment and centralized enrollment system. So we're working towards that. We're looking at integrating AI tools to make the enrollment process even better. But in the short run, we've improved our systems and our processes to where we're not concerned about delays or challenges. We should have a very smooth, pleasant open enrollment season.
And with that, the central enrollment platform, I know OPM has kind of been working towards trying to expand what was created for the postal plan to FEHB as well. Is that something OPM is still looking at, or how else are you trying to modernize the way open season runs?
There's some benefits within the Postal Services plan that I think can save money. So, for example, Medicare Part D enrollment, or different areas that we might be able to expand that across to FEHB. But the centralized enrollment is just huge. We've seen a lot of improvements in efficiency, sign-ups, customer satisfaction, and so we want to take a look at expanding that over, and I think that's going to be a topic of much discussion this year. Not sure how long it'll take, but they did a wonderful job of building that out, and we'd like to replicate that for sure.
And leading up to open season as well, what do you do to work with different agencies, make sure the word gets out, and how do you work with them to make sure that open season runs smoothly?
Yeah, so we have a lot of really good teaming partners, if you will. So many of the enrollees just work through their agency. So we're going to try and push the agencies to do a lot of communication with their team members. A lot of retiree systems out there. We're working with them to expand their communication and give them the tools that they need. And then even the unions. We worked with the unions, did a presentation to them last week or the week before last. And so we're looking at them as a valuable team member to share information as well.
And also, now that we're in open season, can you talk a little bit about how you will measure the success of this year's enrollment period? What are some of the things that you're going to be checking on over the next several weeks?
Yeah, so one of the biggest areas of focus, something that we're going to be monitoring, are the customer satisfaction results. So we want to see how well we're serving and the impact that we're having on the people that we serve. So we'll be looking at that aspect of it. You know, I do want to watch the amount of change. Or do we stick at 5% of our enrollees that are switching from plans, or do we see an increase in that? And then some way to ideally monitor that in the future. And then we'll take all of that in and see what we can do to improve our systems and processes to make it even better next year.
And for enrollees who are looking to take advantage of open season, what are some resources, or where should they go for more information?
Great question. So our goal is to offer just high quality, affordable care to all of our participants. And we have to have participation from everybody to be able to do that. So November 10th is when we start off, and then that closes December 8th. And so we encourage everybody to take the time, and I'm talking maybe an hour of your time, to jump in and look at the different tools that we've created, the comparison tools, watch the videos that we may roll out, and make sure that you're picking the plan that's best for you, because our health insurance, it is personal. Everybody has different lifestyles. Everybody has different health needs and health conditions. So take a look at the plan that best fits you. For FEHB, they can go on to opm.gov/open season. And that's a great starting point. And then the postal employees can also log into the PSHB portal. And there's decision tools within there as well. And then I want to note that benefeds.gov, so benefeds.gov, is where employees can compare dental and vision plans. And they've come out with some new components this year for dental and vision that I think will be beneficial. So employees should check with their agency's HR staff, communications, and just look for specific deadlines or specific instructions.
And one other wrench, so to speak, that's been thrown in all of this for the preparations leading up to open season at least is the government shutdown. Can you talk about how OPM works to prepare for open season and to run open season in the case that there is a shutdown?
You bet. So obviously we're talking to the federal employees, and so they know that there's exempted, accepted, and furloughed. But within HNI, and for the most part, a lot of OPM, we're exempted to where we understand that healthcare needs don't stop, and we're going to have to continue to work through. So we're all working and making sure that everything's going to be a smooth process for y'all.
And anything else that you want to make sure enrollees know as we head into open season? What should they really be looking out for this year?
Just really no advice right now. Do your best on the open season. Make sure to pick a best plan, and then please stay tuned for the changes that we're going to try to do this coming year, to where I may need your support, and hopefully we can see a much lower premium increase next year.
You mentioned that you want premium rates to go down next year. Is there any way to predict the trends in premium rates for the next couple of years? I know there's been, as we talked about earlier, a lot of big increases for the past couple of years. Any way that you can try to predict some of those trends or try to keep them down?
Yeah, great question. So the way these plans evaluate the next year's increases, it's say 40% of what happened this year, and then 60% of what they're anticipating will happen next year. So by creating a smarter plan design, I think we can really modify what they're looking at going forward. A lot of what's going to happen this year is already baked in. We have our coverage boxes, we have what's being covered, and so it's really hard to change, and we call it a $79 billion ship that we're trying to turn. So that's a little bit difficult to change the existing year, but we can start changing the forward outlook by moving towards the WellCare plan, by focusing on fraud, waste, and abuse, and then tightening up our enrollment. And then the second component is all of our carriers. You know, we have close to 40 different carriers and close to 200 plans, but all of them operate off of this model to where they have a performance assessment. And so we're looking at that performance assessment, and a lot of the things within that assessment incentivize components and decisions that are really opposed or slightly different than where we're going with the WellCare plan. So we're hoping to incentivize the carriers to make better decisions, to provide better health outcomes for our enrollees with this performance assessment.
And is this something that enrollees are going to see in the short term, like plan year 2026, or when would they actually expect to be seeing some of these changes?
The next 3 months are going to be a really strong push from healthcare and insurance at OPM. And we have really up until June of next year. But as we look at the overall landscape right now within the federal government, we truly have a Secretary of Health that's fighting for the real overall well-being of health. We have a president that truly cares about it. And then we have a lot of appointees that are trying to make a big difference. And so it's a massive shift in the paradigm of how we look at healthcare and really start looking at outcomes versus prescriptions and a lot of the things that have made us an unhealthy population.
Well, just to wrap up, Shane, was there any final message that you want to leave our audience with today?
Only thing I can close with is it's an honor and a blessing to serve you all, and I hope I serve in my role well, and we'll see based on the outcomes from next year and perhaps the following year.
Great. Well, thank you so much for being here today.
All right. Thank you, Drew. I appreciate you having me.
Of course. Today's guest is Shane Stevens, the Associate Director of Healthcare and Insurance at OPM. I'm Drew Friedman, and you're watching Federal News Network. Now we're going to go back to the studio for more on our open season exchange.